Great. Well, good evening, everyone. Welcome to this is our first seminar, the National Forest Gardening Scheme, on our series of 4 over the next 4 weeks, focusing on well-being and green social prescribing, well-being in healthcare settings, design of forest gardens for well-being, and then a final seminar in which we wrap up and take stock. So these seminars are run by the National Forest Gardening Scheme, and for those of you who don't know about the scheme, our purpose as a community interest company is to promote the take-up of forest gardening at a community level in publicly accessible spaces. That's our social mission. And last year, some of you may have also attended our series of seminars around a variety of themes on forest gardening. So this is our second seminar series. So my name is Richard Love. I'm one of the directors of the National Forest Gardening Scheme, and there are several other directors. And my role tonight is to welcome you, to explain how this session will work tonight, and introduce our speakers, set the scene and introduce our speakers. So I probably wanted to start first of all by just going through a few tech points. Hopefully by now most people are fairly familiar with remote conferencing facilities like Zoom and others, so I hope that you'll know your way around most of the tech. But just to say, please make sure if you're not speaking, you remain on mute. And you'll find the mute button in the bottom left-hand corner, and you'll see a sort of a red microphone when you're on mute. So please remain on mute unless you're speaking. And when we put you into breakout rooms, there'll be an opportunity to speak. This session is being recorded, so if you don't want to be recorded, please don't. It's the main session that will be recorded, so please keep your camera off and don't talk if you don't want to be visible on the recording. When we get to the speakers, and if you have questions for the speakers, we're going to invite people to put those into the chat box. The chat function is the chat icon in the middle of the screen at the bottom, so you can use that to post your questions. Hannah, who is giving tech support today behind the scenes, she'll gather up those questions and try and answer those as we go along. So please use the chat function for posting questions. And the other thing is, when we put you into breakout rooms in the second part of this session, there'll be an opportunity for you to small groups to exchange and to talk. Those being put in the breakout rooms will happen automatically on a time basis, and you'll be allocated rooms, and you'll appear in there, and then you'll reappear at the end to join back in plenary. So those are the key tech issues I wanted to just go through. Now I'd like to just explain the structure for tonight. So I'll do a brief introduction to set the scene. Then we've got 2 speakers tonight, and I'll introduce those shortly. 15-minute slot for each speaker, so that'll be 30 minutes for the speakers. Then we've got 10 minutes to answer questions, and we will select those questions that seem to be the most interesting that we can't answer in the chat function, and we will manage those. Hannah will actually be reading out the questions rather than inviting you to ask those questions yourself. This is just to expedite our ability to get through as many questions as we can. And then we'll have I'll give you an explanation about the breakout rooms and how we will work those. And we'll have breakout rooms for 25 minutes. Then we'll be doing feedback for 10 minutes. I'll invite just a handful of people to share some reflections from the breakout room discussions. So that's what we'll be doing tonight, and we're aiming to end at 9 o'clock tonight. So Hannah, could you pop up slide, please? So this is just to really set the scene for our speakers, and it's thinking about really think at the core of all these sessions are well-being, and well-being like gardening with nature. And as I've looked at the issue of what I think we're facing globally, the climate crisis and the ecological crisis are well known. What I think predicted and evidenced by the World Health Organization is what I think of as the well-being crisis. So I think we've got 3 concurrent global crises, and for me this arises out of disconnect of self, community, and the rest of the ecosystem, as depicted on the left-hand side. And looking at the right-hand side, what we think in the National Forest Gardening Scheme is a key role that forest gardens can potentially play in meeting the 5 ways to well-being depicted in that circle there. And the benefits of particularly contact with nature, the benefits of working in community, and good food, nutrition. And I just wanted to read something to you. There's a book, a fantastic book here. This is about the Japanese art of forest bathing, Shinrin Yoku. And I just wanted us to listen to this lovely quote that I'm going to read out now, that I think really talks to some of the profound aspects of our nature connection. So, nature feeds our souls and brings us joy. Many people think we have more than 5 senses. Some people think we have 8 or 12, but most of us agree some ineffable extra sense, a 6th sense from which we connect with the world beyond ourselves. Perhaps this is our sense for happiness. This is what we feel in nature that can be so hard to describe, a feeling of wonder and excitement, transcendence, and even ecstasy. And the more trees there are, the more likely we are to feel it. Indeed, studies have shown that the greater the scenic beauty, the more happiness we feel. It is when we connect to nature with all our senses that the magic happens and our lives can be transformed. Immersed in the natural world, we can experience the miracle of life and connect something larger than ourselves. Nature takes our breath away and breathes new life into us. Great. So I now want to introduce the first of our 2 speakers. So Elizabeth Westaway, who is one of our National Forest Gardening Scheme members, who has a professional background in nutrition, food, and very much engaging in the whole well-being side of forest gardening, is going to set the scene. And then she'll be followed by David Wixted, who's a GP with the Lambeth Food Co-op. So without further ado, I'm going to hand over to Elizabeth. Thank you very much.
So just as an aside, Elizabeth had some challenges with her internet, so she recorded her presentation, but she is here on the phone, so I'll play the recording of her presentation, but she's also here on the phone able to answer questions afterwards. So I'll just play that now. About this, everyone.
Speaking this evening on social prescribing and community gardens, nourishing body and soul. Next slide. I want to start by highlighting business as usual, where the increased industrialization of our food systems has led to both environmental degradation and epidemic levels of lifestyle-related diseases, such as obesity, type 2 diabetes, and cardiovascular disease. According to the 2020 Global Nutrition Report, 1 in every 9 people in the world is hungry, and 1 in every 3 is overweight or obese. In England, 28% of adults are obese and a further 36% are overweight. Now, overweight and obesity increase the risk of developing diet-related non-communicable diseases such as type 2 diabetes, cardiovascular disease, and cancers. So at the same time, our healthcare system continues to prioritise pharmaceutical intervention over lifestyle changes like diet and nutrition. Next slide.
If they win.
So this quote by Wendell Berry nicely describes our current predicament. People are fed by the food industry, which pays no attention to health, and are treated by the health industry, which pays no attention to food. Next slide, please. In order to move forwards, the entire food system must be transformed to ensure health, equity, and environmental sustainability. We need to also appreciate that health begins with food, and healthy food begins in the soil. Hence, healthy soils equals healthy plants, equals healthy food, equals healthy people. Next slide, please. So what if the ultimate goal of farming is not the growing of foods, but the cultivation and perfection of human beings? I'll just say it again. So what if the ultimate goal of farming is not the growing of crops, but the cultivation and perfection of human beings? Masanobu Fukuoka's quote offers a new way of looking at farming, health, and well-being. Current shifts are happening in farming practices with agroecology, agroforestry, silvopasture, regenerative agriculture, and permaculture, which improve soil health and produce nutrient-dense food that is flavourful, aromatic, and nourishing. However, we also need to transform the healthcare system to being salutogenic. Salutogenesis is a medical approach focusing on factors that support human health and well-being, rather than on factors that cause disease, which is pathogenesis. So, for example, this could be promoting sustainable healthy diets, which support the preservation of biodiversity and planetary health. Salutogenesis is also considered an assets-based approach. Next slide, please. So in this regard, I want to highlight the work of the Rodale Institute of the USA, which recognises this need for change in their paper, The Power of the Plate, the Case for Regenerative Organic Agriculture in Improving Human Health. They propose a new vision called regenerative healthcare, which is defined as a system in which farming and healthcare work together to inform a prevention-based approach to human and environmental health. Right, so rather than relying on toxic chemicals to solve agriculture issues and pharmaceutical interventions to manage disease, regenerative healthcare aims to prevent disease through an organic, whole foods, plant-forward diet that begins on farms that work in harmony with nature. Next slide, please. So the report recommends 9 actions to create meaningful change in food and the healthcare system. And I wish to highlight recommendation number 4, which is implement more localised integrative health initiatives. In the USA, an increasing number of medical institutions and hospitals are implementing programmes that focus on increased patient access to fresh fruits and vegetables as part of improving health measures. And some of these initiatives, which I've highlighted, include garden-based programmes, subsidised food boxes or CSA programmes, community gardens at healthcare locations. And what they've found is that programmes providing patients with better access to fruit and vegetables appear promising, with early studies documenting significant improvements in health outcomes and cost savings, thus showing that food is medicine. So this all sounds very exciting, and there are similarities with what's happening in the UK in relation to social prescribing. Next slide, please. So social prescribing is not a new concept. It's been around for years, with many people describing it as the community development approach to health and well-being by considering the wider determinants of health to reducing health inequalities. It's a growing movement that connects people with a wide range of non-clinical programs, services and events in their local community. It's a service that goes beyond the GP's prescription pad, and it's designed to support people with a wide range of social, emotional or practical needs across a number of areas such as physical activity, diet and nutrition, mental health and social support. And it also supports people to take greater control of their own health. So social prescribing is often referred to as a more than medicine approach to health and well-being, based on the fact that the majority of long-term conditions or chronic diseases such as cardiovascular disease, chronic respiratory disorders, cancer and type 2 diabetes can be prevented by lifestyle change alone. Next slide, please. Here are some formal definitions. Social prescribing is a process of enabling frontline staff to refer individuals to a link worker to provide them with a face-to-face wellbeing conversation during which they can learn about the possibilities and design their own personalised care. It supports people via social prescribing link workers to make community connections and discover new opportunities, building on individual strengths and preferences to improve health and well-being. And it's a non-medical process that uses assets to support what matters to a person rather than focusing on what's the matter with them. So green prescribing is the term used for social prescribing of nature-based interventions on land, such as gardening and food growing. Next slide, please. A recent BMJ article, co-authored by Michelle Howarth and Mike Hardman at the University of Salford and others, reviewed the evidence for the impact of gardens and gardening on health and well-being. And the paper concludes, gardens and gardening can improve the health and well-being for people with a range of health and social needs. The benefits of gardens and gardening could be used as a social prescription globally for people with long-term conditions. Next slide, please. In a paper by Al-Delamy and Webb in 2007, lists the potential benefits of community gardens. As you can see, there's rather a lot of them, ranging from physical activity, improved diet, education about healthy food, improved physiological indicators, improved well-being and mental health, improved cognitive function of the elderly, social cohesion, integration of new immigrants into society, empowerment, improved food security, and an additional source of income. So empowerment can relate to individuals or the community. And community gardens are therefore an important health promotion intervention to address the wider determinants of health and improve people's quality of life. Next slide, please. So what is a community garden? Well, it's described and defined by the American Community Garden Association as a place that can be urban, suburban or rural. It can grow flowers, vegetables or community. It can be one community plot or it could be many individual plots. And the American Community Garden Association state that community gardens have a vital role to play as we begin the long process of healing in 2021. Now, the photo is of Woodlands Community Development Trust in Glasgow. This runs a broad range of activities, including Woodlands Community Garden, a community cafe, workspace, neighbourhood food service and neighbourhood recovery project. So there are strong links between community gardens and forest gardens, and community gardens provide opportunities for incorporating the 5 ways to well-being. Next slide, please. I would now like to spend a few minutes showcasing 2 community urban food growing projects. The first one is the Grow Well project in Cardiff, and the second is the Grow Share Cook project in Plymouth. The Grow Well project is a partnership between Grow Cardiff not-for-profit and the NHS. Grow Cardiff supports people across Cardiff to create and sustain community gardens. The Grow Well project allows GPs at 11 surgeries to socially prescribe activities at 2 community gardens to patients they think may benefit from the physical activity, social contact, or therapeutic and health benefits of food growing. Activities include things like weeding, watering, harvesting, creative arts and crafts, making raised beds, and digging ponds. If prescribed, patients join other patients and participants involved with the garden, and sessions are run by a professional with a background in occupational therapy and gardening. In an evaluation of social and economic impact, social impacts included improved well-being, healthier behaviours in relation to physical activity and fruit and veg intake, reduced isolation, and greater optimism for life. The economic impact shows an estimated saving per person of £212. So for each person prescribed a community garden activity, Grow Cardiff predicts an annual saving of £212 on statutory services based on Welsh Government figures. The second project is the Grow Share Cook project, commissioned by Plymouth City Council and Plymouth Community Homes and delivered by Tamar Grow Local and Food is Fun, which are both non-profits. It's for people experiencing food insecurity or people at risk of type 2 diabetes who are changing to healthier diets. They are provided free bags of seasonal fruit and vegetables and cooking sessions through social prescribing from a GP, with vegetables sourced wherever possible from local producers, including community growing initiatives. In the 2016 process evaluation of the project, of the 89 participants in round 2, 90% reported improved cooking skills, 87% reported an increased consumption of healthy food, and 79% reported to have healthier diets. Now, there are plans for a similar project to be established in North Devon, so I'd say watch this space. Next slide, please. I just want to leave you with this quote by Charles Massey, which I find very relevant. If people ate truly nutrient-rich food out of healthy soil, you would slash the National Health Bill straight away. Thank you.
Great, Elizabeth, thanks very much. Hannah's now going to load up the next presentation and David will be speaking, and we'll take questions on both presentations via the chat function.
Yes, go for it.
So thank you very much indeed for inviting me, and very interesting presentation, Elizabeth, thank you. I've been a GP in Brixton, Camberwell for about 23 years, and for the last 7 we've been part of the Lambeth GP Food Co-op, which is a group of practices where the co-op has helped them to build gardens either on their premises or close by for patients to come and work together. And so this is an example, if you like, of something that might be socially prescribed, if you like. I mean, many of us think we've been doing this for years. It's just that now the NHS has actually paid for a person to be in our practice, to get to know everything that's going on in the local community and to refer patients and make the link for them. And the co-op made a quite a good explanatory film, which I'd like to show you now, if that's okay.
The Lambeth GP Food Co-op is a community-led cooperative of patients, doctors, nurses and Lambeth residents who grow food together. We work in partnership with GPs across the borough, building gardens in GP surgeries and developing unused spaces for food growing purposes. We have built 11 food growing gardens in GP surgeries where patients are actively involved in growing food together. including a garden in King's College Hospital, where we have a monthly stall selling patient-grown food. We were awarded the Best Sustainable Food Initiative in the NHS by Public Health England and the NHS Sustainability Unit.
It got started from a conversation with GPs, patients and nurses located in Lambeth, who were interested in whether we could create a network of food growing gardens across general practice in Lambeth. We were fortunate enough to attract support from Lambeth Council. We also have a very forward-looking and visionary clinical commissioning group in Lambeth, who also funded us to get the Lambeth GP Food Co-op up and running. We have a community across the borough who are involved in different activities interlinked around food, diet and nutrition. The aim of this project is to influence food procurement. It's one of the aims in the NHS. We have 60 hospitals in the M25 corridor. Not one of them buys anything grown locally. We're looking at this one as having an economic context as well as a therapeutic context.
Being part of the food co-op is part of a much bigger ambition that we have, which is really trying to melt away the walls of the surgery and become a much more open building or place for the community where they can come and have access to health and well-being.
The kind of patients that I recommend coming to the garden are people who may be a little bit isolated, maybe they have depression, low mood, other mental health problems that make it difficult for them to get out.
Those with long-term conditions or who are socially isolated, or anybody actually who's interested in keeping fit in another way and meeting other people in the group.
My name is Lil Sullivan. I'm an artist and a singer-songwriter and a stroke survivor. I heard about it in the doctor's surgery. It's nice to go to Brixton and see all the different people. I'd like to do the portraits of all of them. They're so interesting.
I like gardening. I like to be outside sometime doing things. Like to get my hand dirty.
I like that the gardening group is meeting people and they're very friendly and easygoing and there's no pressure.
We're bringing back some of the key values of the NHS back into this garden, and those values are around mutuality, support, learning and cooperating together.
So you can see how wonderful it was. This was like a bare concrete before, so you can see how much it's changed. We've got a little oasis.
The small ones, I'm planting them back. And then I'm covering them with the earth. And I always have potatoes.
I just like to talk. It's just lovely to go to a place where you can have an audience and you can do something as well. I don't like going to coffee mornings or things like that. I have to do something that is constructive, and doing the gardening is constructive.
Well, I think it's a good project because, as they say, the social, you get like a good social life. Everybody's friendly, they treat you good, and I just think it's an amazing project, really. I mean, I have fun. I even bring my grandchildren here sometime, and they enjoy it. So I think it's really, really good for them. It's good for the soul. It's good.
So in the future, as time goes by, we'll see how we can manage.
I'd like to see more funding and more people coming to the gardening classes.
Because we then see those patients less often in our clinics, we think this is a good way for patients to keep well.
It's helped me a lot, so I'm thinking that a lot more people get involved in it and see what we do.
I feel good as a doctor because it's something other than
social prescribe,
and I have only seen
surgeries.
People who come here. So one patient told me that her blood pressure was much more controlled.
Because patients go in there for social interaction.
And thinking of other patients, I've actually seen less of them, which surely must be a good sign.
It's really about creating a new sort of environment which promotes health and well-being, rather than just having it all in my room.
Okay. So that works in our garden, and we have managed to get crowdfunding to have a paid gardener to to work with the people who come to the garden. Sometimes it's run by a volunteer, sometimes it's run by a patient, and sometimes it's run by a paid gardener. And what we find is that all these initiatives take quite a bit of time to get off the ground. You need to have patients coming back telling you that that was great before people become aware of it. But we've managed to sort of keep it going over the years, and we've sort of got different link ups. So there's a link with a local restaurant where patients go over the road to the restaurant and the garden at the back of the restaurant, and a local homeless hostel near our surgery has just is just working with us now to create their own garden. Hannah, I can't see the slides. I don't know if it's possible for you to show them. That's good. So if we go to slide, probably slide 4, please.
Why is it on your screen?
I wanted to talk a little bit briefly about the some of the evidence that makes gardening so good. There's studies, is a good collection of studies in the King's Fund called Gardens and Health, which collects together quite a few research studies. One says 10% increase in exposure to green spaces led to an improvement in health equivalent to being 5 years younger. And quite a lot of people are involved in gardening. 50% of adults report gardening as a free time activity. Gets a bit higher as you get older. And 87% of UK households do have access to a garden. That's a bit less in London, and apparently black people are 4 times less likely than white people to have a garden. We know there are long benefits of gardening on mental and physical health, and it's often, you know, it's often a major part of therapy in the old psychiatric institutions, and is also being used now. There's another nice little study which was done actually in this summer by the landscape. It was published in the Journal of Landscape and Urban Planning in September 2020, and it involved taking 38 bare front gardens in Manchester and putting plants on them, and then measuring outcomes 3 months later. They managed to show actually a reduction in cortisol levels, which is the sort of stress hormone. 22 out of 38 said it helped them to feel happier. 17 said it would help them to feel relaxed. So that was just having plants just available for them to look at. So building this into our everyday working lives as GPs, you know, I'm often told, well, I know we're very busy, and I'm often told by other GPs, we just don't have time for all this fluffy stuff. But actually, maybe we should think about what we call brief interventions. So we'll often say, you know, have you thought about stopping smoking? Maybe we should actually be saying, can you see flowers or green space from where you sit? How could you change that if not? That's one thing we could do. The second is that we could remember how we can influence people, so that when things are happening in our local area where a park might be threatened by being built on, or a piece of woodland being cut down, we as GPs, and perhaps encouraging our patients, should make a voice, because that is as important for health as many of the other things we can do. And finally, I try to encourage my trainee GPs and medical students to take analogies from nature when they are discussing things with patients. Nature definitely mirrors life. And a few years ago, myself, in our family, my wife and mother of my 3 children died very suddenly. And I found it very helpful going into our local park and just sitting, leaning against a tree that I know had been there for hundreds of years and had seen many things, perhaps a pandemic or 2 in its time. And I looked at the trees opposite and noticed, you know, one of them had its branch torn off in a storm, and it was really looking out of shape. And over the years, sitting from that same tree, I could see the tree that's branch had been torn off gradually regained its shape, slightly different, but nevertheless, it managed to survive. And that was quite a powerful message to me, as our family also changed its shape and survived. So I think I'll leave it at that for now.
David, thank you so much. That's a really wonderful presentation from both yourself and Elizabeth. I've been scanning the chat box, and I think some of the questions asking for information have been responded to. So I think we've picked all those up. But I'd just like to now open up to see if anyone would like to ask any questions in the next few minutes before we go out into the breakout rooms. So we've got David and Elizabeth here to answer those questions. So if anyone would like to ask a question, please take yourself off mic. And if you want it addressed to Elizabeth or David in particular, just say. But please feel free to offer up your questions.
Yeah, I was just going to ask a question. I wondered if anyone was following any of the NICE guidelines, because NICE have actually written quite a lot on environment. I was recently involved in joint replacement guidelines, and I actually recommended gardening as a really good activity after joint replacement, because especially with raised beds and things like that, but also to try and get policy change within maybe GP practices, hospitals and urban environments. It's actually looking at the NICE guidelines.
I have to confess, I don't think I have actually seen those. NICE guidelines tend to be incredibly long and wordy, but I would be very interested in seeing them.
I will email the onto Hannah some of the guidelines that I've used to help Bathscape in Bath actually get some of their funding. They do have them, yes, they are long and wordy, but it's the recommendations that you want to look out for future research. And it seems like this is a good way to go.
Great, thanks Victoria. We'll include that information when you send us the links so that everyone can access it after the seminar. Thank you. Other questions or reflect from anyone else, please? Just again, turn off your microphone and just offer your question up to us.
Yeah, so I was wondering if at the GP surgery, any of the patients that came in with mental health issues struggled to engage in the garden or felt a bit anxious about it, and what did you do to support them to engage in the garden?
I think the person who leads the garden can often be very important, and sometimes in the early days they tended to be retired nurses perhaps who had an interest in gardening but were able to take account of people at different stages and different levels of illness. I think also the option is you can come and go, so you find some people will go once and then won't go for a while, but then they'll dip in later. And what we've found is that if you can get a mix, you sometimes just get a little group of people who tend to come along together. They almost provide their own sort of friendship group. And if you're not careful, then if a new person comes in who's a bit shy, they might be intimidated by that. And what I thought about it is perhaps if you then develop another friendship group, you could have 2 or 3 little support groups working perhaps in the same garden, just on different raised beds. But I think we have to be honest and say it's not horticultural therapy. It's more just people coming together and supporting themselves.
Thank you.
Oh, am I okay to ask a question?
Please go ahead, Angela.
Hi, thank you so much for sharing with us, David. I'm starting a community garden in our area, and as well as looking at doing some horticultural projects in the community to help brighten up the area. What you're talking about with the green prescribing, I'm finding really interesting and really connecting with. So how would I go about approaching my local GP with that? Would I go via the council, or would I talk to GPs direct?
Well, the slight disappointment I found was that when you mentioned social prescribing and everybody's very excited about it in the NHS, it doesn't seem to have come attached with any money. It just comes in the form of
the project itself, the garden, and the projects that I'm running. Other projects are currently unfunded, so we're using the community resources and other bits of funding. We've got attached to green spaces and to other sort of fitness wellbeing programs. So at the moment I wouldn't need money, but I was thinking more in terms of we will have this space, we will have the facility to invite people to whether it's working on the community plot or also looking at doing other things with people's front gardens. And we've got a large elderly community that need these sort of things. And if there are people that want to come and work, and as you say, for social reasons and for health reasons, then trying to make that connect between the things that our community needs, our elderly community needs, that aren't currently being furnished, with people that would want to do these work to fulfill other needs, if that makes sense. So
well definitely the social prescriber is usually employed by the PCN, which is a primary care network, this new sort of grouping of maybe 5 or 6 practices together. So if you could find which PCN your practice is in, and either ask your surgery manager or GP who the contact is, who the social prescriber is, and then just let them know. And they use a sort of database of local resources. So if you can get yourself on that database, in our area, it's actually run by Age UK, and who actually employ the social prescribers and then sort of fund them in.
Yeah, no, that's wonderful. I
thing.
kind of, from what you've just said, I have an idea, well, at least a starting point of the person who I would need to get in contact with. So thank you so much for your help, and I really enjoyed your talk. So thank you so much.
Thank you.
Great, Angela, thanks for that question, because that and other questions in the chat box segues into this next session. We want to put you into breakout rooms now. We'll try the breakout rooms with 6 people in each room. So I just want to give a brief explanation of that. But the purpose of the breakout room is to explore a couple of key questions, and those questions will appear in the breakout room. So please write them down, but they'll also appear in the breakout room. So the first question we would like you to reflect upon together: what barriers are there to expanding green social prescribing to community food growing projects, the likes of which we've seen a while ago, whether they're forest gardens or other types of garden? So what are the barriers, and how might those barriers be overcome? The second question is, how could our health, social care and local government systems engage more with and support community food growing, whether forest gardens or other types of gardens? So those are the 2 questions. Again, you'll find those in the breakout room. Now, I just want to give you a little bit of guidance around how the breakout rooms will work. So you'll be put into these automatically by Hannah, and then you'll be brought back at the end of those, and then we'll have something of a debrief. The questions you'll find in the chat box in the breakout room. So the main purpose is as an opportunity for you all to engage in dialogue and exchange your experience, your advice, in a way to build up understanding and potentially links. In order to support, try using an application called Jamboard. Jamboard is like a flip chart. It's like a series of flip charts, and you can put post-its, virtual post-its onto the flip chart. Now, I would say if you can't get the link working on your computer, or it's a bit difficult for you to find out how to use them, don't worry too much. I'm sure there'll be at least one person in your group who will be able to operate that virtual flip chart. The most important thing is the conversation, so don't get too caught up on whether you can get the app working or not. If you can get the app working, what you'll see is that you've all got the same link, and you will have a group number, and that group number should correspond with the flip chart, the virtual flip chart sheet that you're using. So when you go in the Jamboard link, you'll actually arrive on page 1, and as Hannah's showing here, you can move along to the next page to find the right one that corresponds with your group number. So I hope that will be reasonably clear for you. As I say, please focus on the dialogue and exchange. Use the Jamboard if you can. If you get stuck, also you can use the chat box. We're going to collect your sort of reflections, because this will help us feed into the final seminar. So we are hoping to be able to use those. So I hope that's clear. And Hannah, will you be able to pop people into the breakout rooms now, please? And we'll see you back here in about 20 minutes. So welcome back, everyone. We're just bringing everyone back from the breakout rooms. The most important thing is I hope that you all had enriching conversations and were able to exchange experience and learn from each other. We'll have some material from some of the Jamboard flip charts, the virtual flip charts. So we've captured that which was written, and anything in the chat box will also harness that and collect that up, and so that'll be really helpful for us to feed into the final seminar. We try to bring everything together. I just wanted to spend maybe 5 or 10 minutes, and I don't want to go through the details of your discussions, but if anyone has any top-line reflections, and I'd like to ask you to think about these questions. What was it that really struck you about your conversation? What's the latest fresh thinking that you've got from hearing our speakers, Elizabeth and David, and or from the conversation you've had? What is it that really struck you? What's your freshest thinking that's come out of this for you tonight? And it'd be great to just hear from a few people, 2, 3 or 4 people. If you'd like to share with everyone, it'd be great to hear those reflections. So would anyone like to just turn off your mic and step into the plenary and share?
I'll kick us off, Richard, with a rather large one. We want systemic change of the whole food system in the UK, please.
Yeah, so it's I guess that was a strong point that came across for Elizabeth at the start. Yes, it's a very deep-seated change. Yeah. So it's a whole system. It's a whole system issue here. We've got to work at the garden level, but we also need the system to support that change. Thank you. Other reflections?
Yeah, can I just say, I just think collaboration is so important, and learning from other people. That's what I really find vital. And it's been so inspiring today to hear so many things. I'm going to listen to this recording as well, because there's so many things I've kind of gathered up. And I thought, oh, I need to hear that again. I need to write it down. So brilliant. Thank you.
And thank you, Helen. And if we think about forest gardens, the analogy is that forest gardens it's about co-planting, complementary planting. It's working together as an ecosystem, and that's what we as humans need to also engage in.
We talked about the same sort of thing very briefly in terms of a web of connections of different groups and different organisations.
Yeah, so it's come up in at least 2 groups.
This is Kate. I'm on a different continent from all y'all, and I'm in Canada. And I just want to say how jealous I am of how far along you are in integrating nature and horticultural therapy and gardening with healthcare. We're getting there, but we're nowhere as the thinking isn't as advanced or as pervasive as you've got, and I'm just really jealous.
Kate, thank you for those words, and perhaps that's reminds us that our collaboration, of course, we're thinking about in the UK, but it's also an international collaboration. There's lots of great indigenous learning, and indeed the temperate forest gardening tradition draws from many indigenous food growing practices. So let's think internationally and work internationally as well. Would anyone else like to share their reflections?
Yeah, one from our group, Richard, was it seems that there's lots of people having lots of mini battles across the country, and we need to make that more of a collective. and especially in line with support functions. So if I've got a problem with my car, I can go to lots of online forums and get support on, you know, how to change the disc brakes and the engine oil, etc. And how do we make something like that available in terms of funding for individuals that are running projects?
So there's what I'm hearing there partly, Mike, is the really deep importance of a peer-to-peer support and exchange network.
Yeah, which could remain, you know, remain live. And what feedback are other people getting at that moment in time from bodies that are, you know, that are granting these funds that individuals will need to kick these projects off?
Yeah. And as well as that, we got some resources on the National Forest Gardening Scheme website. I think we're all well aware in the UK context, land is really expensive and difficult to get hold of. So there's a document around planning. There are also other documents, a document prepared by Hannah, who's supporting the tech here tonight, on the making the business case, if you like, for forest gardening, community food growing projects, ecological, air quality, a range of benefits. So there are some resources there, but we'll pick up on that point about peer-to-peer support. Thank you. Any other reflections that anyone would like to share?
I think one of the main things that came out of it was that it was the community projects needed to be in place. That was the primary conclusion, and that if they were available, then people could be prescribed into them. So the priority should be the projects. Yeah. So those actually we need those community gardens in every locality. Proximity is really important. And for those of you who are aware of the United Nations Sustainable, one of the targets is around access for everyone to green spaces, to be able to connect with green spaces. And we're advocating here as a group, as a community, green spaces, but green spaces that make provision for community food growing, particularly. So a particular type of green space. So yeah, we need those spaces, and then we need to be connecting in with our medical GP practices and social services to say, hey, we're here, there's a resource. Can you signpost people here? That also brings perhaps the need for extra resources to support additional people coming in. So we need to think about how we can be in service of people who can benefit, but we might need to think about the resource side as well. Great. Any last reflections? We're coming up to the top of the hour, and I'll bring us to a close, but any more reflections from anyone, please?
David, just talking back to the point that you were raising here, I think a lot will depend on what the local authorities' view is of food and food growing. And you know, this is going to vary, you know, tremendously from enlightened authorities that might be part of the sustainable cities, food cities, to others that have virtually nothing in their planning regarding local food growing, etc., etc. So to some extent, you know, that might be a starting point in terms of where is the local authority at, and if it has got some useful things there that one can work with, then that's great. If they haven't, then obviously it's going to be a long slog.
Yeah, I think David may have had to gone off now, but Ivan, I just want to pick up on that really important point. I mean, 4 years ago, I tried to kick off a debate at the Oxfordshire county level, and I found, well, with all respect to Oxfordshire, not exactly at the forefront of this sort of thinking. And I came to realize that actually trying to connect the people in the council, particularly on the public health team and otherwise, into their peers in more forward-looking areas. So I have an old friend down at Bath in North East Somerset, but I think using the peer-to-peer professional support, so pointing local authorities who are perhaps less imaginative and forward-looking, connecting them with people who are really at the cutting edge. You know, we've heard from the GP food co-op and say, hey, have you seen what's going on here? These people are leading the way, why don't you talk to them? I think that can be more powerful than perhaps members of the public.
Yeah. Sorry for calling you David. Yeah.
Fine. Yeah, great. Okay, we've probably got time for one last reflection if anyone wants to share.
I think this didn't really come up in the group thing, but recently I had a lecture from a recent study about influencing politicians on climate change, and the person who'd done the research, we sort of asked what does she think is the most influential thing we could do, and she was talking about supporting our local authorities to lobby central government for things, so helping the local authority to have a voice with local government. So maybe as well as informing local government about what's in the area, it's also about supporting them maybe to make some of these systemic changes. So yeah, that was just a thought that came to me.
Yeah, thank you, Angie. Yeah, I mean, we play a role to support our local government and our care services too. I mean, that probably what that reminds me of is that we've assembled some of the evidence base, and Elizabeth has shared a lot of references. I'm sure most of us, if not all of us, are aware of George Monbiot and the book he's written after the crash. One of the points he makes is that actually it's stories that make a change. So I think we need to have the evidence base to advocate, but we also need to tell powerful stories. It's a sort of story that we were hearing from David, and as shown in the film from Lambeth. So let's marshal our evidence, but let's also tell the story to the people and be passionate and be convincing, so that we'll really lever the most effective change in that way, I think. So I want to bring this to a close now. I want to thank everyone for attending. I want to thank Elizabeth and David for presenting to us. I want to thank Hannah and Nikki for being key to help put this and the other 3 seminars that are coming up. And for those of you who haven't signed up, we've got sessions for the coming 3 weeks, same time. Will be forest gardening in healthcare settings. So we'll be looking at forest gardens in GP practices in hospitals and hearing some experience from that too. So thank you so much. Take good care, and I wish you all the best with all your growing efforts around the country and around the globe. And see some of you next week. Thank you very much. Good night.
Bye-bye.
Bye-bye.
Thank you.
And thanks so much, Elizabeth and David.
Thank you, David.
Awesome.
Thank you. Very, very good.
Thank you, David, very much.
Thank you.
Thank you
Bye-bye.
very much,
Thank
Elizabeth,
you.
David.
Thanks very much.
Thank you too.
Super. Thanks a million for the presentations.
Thank you, everyone.